So this is a very good question. Uh, Currently, the best medication to prevent these types of crises and complications is hydroxyurea. Hydroxyurea has been shown to prevent and reduce vaso-occlusive crises. Um, there are other medications that can also reduce vaso-occlusive crises, but they've not been shown to reduce other complications. So there is L-glutamine, which is FDA approved to reduce vaso-occlusive crises. There's crizanlizumab, which is an antibody that's also been shown to reduce vaso-occlusive crises. And there's voxelotor. Actually, voxelotor has been shown to increase hemoglobin, not necessarily prevent crises. In terms of aplastic crisis or splenic sequestration crisis or hyperemolysis, those are a little bit harder to prevent. So aplastic crisis is typically caused by a viral infection. And so the main way to really prevent a viral infection is to wash your hands, do social distancing, but there's no like medication really to prevent a aplastic crisis. The treatment for aplastic crises is supportive care and then sometimes blood transfusions if the hemoglobin, when the hemoglobin goes down. Splenic sequestration is also a little bit harder to treat. Sometimes it can be triggered by infections like bacterial infections, but not always. And there's no really good medication. There is some evidence that hydroxyurea may be able to help delay splenic sequestration. But outside of that, the mainstay is really just treatment. And so treatment could be things as simple transfusions or even exchange transfusions. And the same thing for hyperhemolytic crises. These are also hard to really prevent. And the main thing is just to treat, to do the actual treatment when it occurs, which is also through transfusions.